So I'd like to give some disclosures here. I am a piecemeal laborer. I'm basically useless without my team. And I feel a little bit awkward giving this talk because I'm still working on all this stuff. I'm not as good at this stuff as I want to be. And honestly, this is one of my favorite talks to give because I think that the people in the audience here have put so many hours into being smart and technically superb. You know, you residents today are such better spine surgeons than I was way back when I was a resident. You know, we just didn't have all of this stuff available. And I'd propose to you that if you put a little bit of time into being a good leader of your team, you're ultimately going to be a better surgeon and your patients are going to do better with a little bit of time put into that, as you've already put in so much time to the other stuff. So at some point, it's hard for you to start thinking, you know, I'm not the student anymore. I'm not the resident anymore. I'm not the learner. You're going to make this jump where you're the leader. You're going to walk into the OR. You are the leader of the team. And literally someone's, life or death kind of hangs in your hands. And how you lead that team and how that team functions in large part determines how your patients do and how successful you are in practice, and honestly, how happy you are going to work and how much other people respect you. So we're going to talk about creating a culture of preparation, empowering team members, having an unrelenting pursuit of excellence, and a few leadership, pearls and pitfalls. So now as a new team leader, there's this balance. We all have a little bit of uncertainty. Am I good enough? Do I have doubts? Versus confidence. And somewhere in between there is a sweet spot. And any given day, you may go one way or the other. And to the guys in the audience, I'm going to ask you to help out your female partners. I think that they're held to an unfairly high standard with this. And I think sometimes if a guy looks confident, a female may be criticized. And if you just create the culture of like, hey, she's awesome, she's great, I think that the OR team will follow your lead on that. So an additional disclosure is surgeons think that the level of teamwork, is higher than other people in the OR. So it's interesting, the residents, the nurse anesthetists, they may think like the level of teamwork is 10%, but the surgeons think it's 75. So I think we have to go into this saying, the teamwork's probably not as good as I think it is. And if you haven't read this book, you should. It's a fantastic book. And the idea of you do not rise to the level of your goals, you fall to the level of your systems. Look at, I think it's good sometimes to look at lawsuits, to do M&Ms, see where things failed. Very rarely does a surgeon go, I hit the aorta. Usually it's a multi-step process of failures. And if we have processes in place, the failures don't take place so much. Now, the tough part is putting processes in place is not that sexy. It's not that fun. You're not paid for that, but it takes work ahead of time. And I like the Scout motto, be prepared. Time that you put into things ahead of time will benefit you and your patients and your team. Do that dirty work ahead of time. There's no way to substitute for that. Create a culture of preparation. So the first level of preparation for the OR is our patients go to a spine class run by nurses. You can't have MDs there because everyone's kind of intimidated by MDs. They'll ask a nurse a question they won't ask you. And every year except for 9/11, the Gallup poll tells us the most trusted profession in the United States is nursing. That year was firefighters. And then what we do also is we let the nurses rise to the highest level of their profession. They take a lot of pride in it. And, I think that we're all kind of tired of checklists, like, give me another checklist. People just start to ignore it. We have checklist fatigue, except for parents. They're not tired of it. So the same checklist that my nurses and residents and fellows have, I give to the parents. And they won't let us forget anything, and they feel like part of the team, and they'll speak up and tell us things they might not have otherwise. And so when I came to Cedars-Sinai, my biggest fear was, am I going to be able to give children good care? Coming from a children's hospital, everything's dialed in from kids. So what we did is we had a day, 25 people came in the OR, and what's amazing is every single one of those people are still there. It's been a consistent team. Nobody's left. And we just practiced on a dummy. I felt a little bit self-conscious, like, come on, who really wants to practice on a dummy? And it was interesting how many of the oldest surgeons there said, wow, I wish I did that. That's a great idea. And then what everyone in the room felt is that they were valued. We put time into inviting them, talking them, and they realize that they're an inherent part of the team. They're going to step up to the plate. They're going to do their best. And we've probably all experienced this when you're in the OR and then some surgeon's mad and he's yelling at the rep, why isn't that here? Now, the truth is, it probably would be here if you asked for it ahead of time, and you probably didn't ask for it ahead of time. So on a Saturday or Sunday morning, when it's really quiet, spend an hour or two, go over every note, every imaging study, plan surgeries, send an email out. It goes out to about 58 people now. And it started out just sending it to the rep. And then the scrub tech says, hey, I want that. And the nurse, circulator says, I want that. And all of a sudden, everybody wants to be included in this email. And most of the time, somebody will send me an email back and say, hey, did you think of this? Did you think of this? Should we do that? And it's not only groupthink, it's also everyone feeling respected. They're part of the team. You value their opinion. And you tell this is an old slide because we all had on masks. But now we have indications conferences. We have 4 fellows, and the idea is every one of those fellows is going to take part in an indications conference to present every case before and after. And you know what? Patients love this. If they hear they're getting 5 free second opinions, that's fantastic. And most of the time, you don't change the plan, but it forces you to think about the case ahead of time and sleep on it. And there's pretty good evidence that if you sleep on something unconsciously, you may come up with better ideas. And a culture of preparation. I can't believe I used to have residents put in a pedicle screw for the first time on a live human. Why was that? Of course, we should sit down in my office together, put a drill in their hand, talk about the theory, spend 20 minutes of preparing to put a pedicle screw in, the way that I do it with a resident. And then, of course, it's going to be better and safer in the OR, and it certainly lowers my stress. So how many times you bring in the C-arm, you're like, do this, and they do something else, and you're telling them to do that? We had a grand round. So we brought in the X-ray techs and the X-ray managers and said, okay, let's come up with a common language. And we now have this in every one of our ORs, and I have to admit, I struggle to remember it. I have to read it. What's the word for this or that? But what it also did is it got radiology to feel that they were part of their team. The manager of radiology came up afterwards. He says, this has never happened before. My guys feel like they're part of the team. They're respected now. So if there's ever anything going wrong, put everyone in the same room, talk about it. We have a common mission. And surgeons believe they shouldn't be questioned. Airline pilots, except for, maybe Korean Air, think they should be questioned. That's okay. But surgeons don't want to be questioned. We have to get over this. We have to encourage people to question us. And at Google, they did a study figuring out what are the characteristics of the best teams. And the one thing that came out was psychological safety, meaning you could speak up and people aren't going to make fun of you. Now, what this means also is when someone speaks up and gives you a stupid idea, you have to go, wow, thanks, let me think about this. You can't let anyone knock someone down for an idea. The ideas will stop coming. But our job is to encourage people to speak up. And it's pretty frustrating when you've told someone something a few times and they don't do it. But the second you point that out, you beat them down. They're not going to want to speak up anymore. You want to be the person who goes, wow, thanks, let me think about this. Be encouraging or the ideas are going to not come anymore. I had a senior dean of the faculty at a medical student say, what's interesting, Dave? Whenever doctors get really angry and they get in trouble, they always feel that it's justified because they're protecting their patients. So when you have an angry person on your hands, most of the time they feel justified. The system isn't working. They have to protect their patients. And I also put this out because we have to be careful of this. The system isn't going to work for us. We're going to be there all night and things aren't going to be there. And we're going to feel angry and we're protecting our patients. But expressing anger doesn't help. As Anthony DeMello points out, when negative feelings come in, now we have 2 problems. Expressing anger doesn't make things better, it just creates another problem and a series of apologies. And there's been studies showing that if you have over-controlling or dismissive behavior on the part of the surgeon in the OR, the whole team's going to suffer, they're going to do worse, and having good leadership later doesn't help it. So the bottom line is you can't really make up for it, but when you do something wrong in the OR, which we all do, it's really hard to just immediately go, you know what, I'm sorry, I shouldn't have said that, I shouldn't have got angry, I apologize. Best thing you do, quicker the better, just like raising kids. You don't make mistakes when we raise kids. And how do we create the atmosphere that people feel comfortable speaking up? One of the things I do is I say, hey, I'm someone's husband. I need all the help I can get. Humor, humbleness. There's somebody in that OR who probably recognizes a complication but is afraid to speak up. A study that Vern Tulloch quotes all the time is there's more complications in ORs where the attending surgeon doesn't know everyone's name. So now another thing, how do we get people to speak up? When we look at pedicle screws and say, are they all in? Or we say, what level are we at? Ask the medical student first. Because if I go, hey, we're at L3, right? Yeah, we're at L3. But if you ask the medical student first, then the resident, then the fellow, you're going to get a pure answer, instead of you just saying where you think you are. And we want to empower everybody in the OR. For pediatric spinal deformity surgery, you want the mean arterial pressures in the 50s or 60s when you dissect, up to maybe 80 when you're changing the shape of the spine. And what used to happen is I'd ask anesthesia, I'm like, okay, are the maps 75? They go, yep. But I'd look over the screen and the maps for 50. Like, well, we're trying. All we had to do was just put a monitor up in the OR. Everybody sees it. And more often than not, the reps will be like, hey, Dave, the pressure's kind of low. I'm like, hey, can we pick up the pressure? Transparency, put everyone on the team, have everyone checking out for things. Okay, so who here is good with names? Yeah, you guys are good with names. Yeah, I'm not. Just ask Woody. Messed up his name today. So I would propose to you that you could be good at names if you wanted to, because I'm going to bet that everybody in the room, if you had to memorize like 300 useless names to get an A in organic chemistry, you could. And if you really cared about names, you'd write down people's names, you'd think about it, you'd use the name. That's one of the most important ways to get people on the team to feel like you care about them. Crisis management. This is a part of that intraoperative monitoring checklist developed by the Vitale team. It should be in every single OR. Think about the crisis before it happens. And when you lose neuromonitoring, have someone else read it, not you. Just go step by step by step by step. And in crisis management, repeat back and forth. I can't tell you how many legal cases I've seen where the neuromonitoring tech says, I told the surgeon we lost signals. And the surgeon says, they never told me. So when you lose signals, they say, we've lost signals. I repeat back, we've lost signals. Yes, we've lost signals. Get over it. It's not nerdy. Repeat back and forth. This happens in the military. This happens in firefighting. You got to repeat back and forth. And phone a friend. One of our ideas is that if we ever lose neuromonitoring for more than 10 minutes, call in a friend. Say, hey, Pat, would you mind coming in the OR? Just look at this. You have a fresh set of eyes. It's not a sign of weakness. It's what you would want with your family member. When you lose signals, you might not be thinking clearly, especially if you're young. It's a sign of strength to call in a colleague, not a sign of weakness. And I learned this from a head of Blue Angels. They're the crack team of flyers. And after every show, they have a 45-minute debrief. And the leader starts off saying, this is what I could have done better. So the conclusion of every one of my surgeries now, take off the gloves and I say, this is what I could have done better. Everybody else volunteers, this is what I could have done better. And, we don't say, glad to be here, sir. But there should be the feeling that, hey, we're all on the team together. We've all said what we could do better. We're going to try to do better next time. And it's really it's an emotionally positive thing to do that together. You kind of let down your defenses and you admit you're there for a higher purpose, a higher mission of the patient on the table. And complications are tough to deal with. You'd kind of It's like, breaking up with a partner or something. You have a tummy ache, you don't want to deal with it, you want to run away. That's when you should see your patients twice a day. Make sure they have your cell phone, and think of it as an opportunity to deepen your relationship with your peers. If I go and say, hey, Pat, this didn't work out too well. Do you mind looking at this? Do you have any thoughts on this? Pat's not going to think I'm a loser because I had a complication. He's going to think, he wants my opinion. He respects me. It deepens our relationship. So transparency is tough, and it's tough to resist defensiveness when you've done something wrong and you can be worried about getting sued. That's really the time to ask for help. Okay, who in this room has missed an international flight because they were late? Anyone? That one person has. Okay, 2 people. So I'd say, if you wanted to, you probably could show up on time for something. And if you're the leader and you chronically don't show up on time for something, it's probably some combination of disrespect and incompetence, and people will notice it. What you're telling people is, my time's more important than yours. You should all sit here and wait for me. That's a very effective way to decrease your credibility in the eyes of the people that have been waiting for you. It's insidious. They're not going to bring it up with you, but people will lose respect for you. You just look like you don't have your act together and you don't care about them. And share successes with the team. We're always going to have grateful patients. Reach back to the team and tell them, hey, this family was grateful. You saved this person. This man's out of pain. They want to feel the same gratitude that you feel. One of the number one ways I've seen people fail in academic medicine is tolerating mediocrity. And it's becoming harder and harder now, to hold everyone to the highest standards. Because if you criticize anybody, they could run to HR, you could look like the bad guy. Anytime you criticize someone or hold their feet to the fire, you're putting yourself at risk. It's easier for us to go, oh, everyone's wonderful. But the truth is, that's not how you're going to have the top team. So there are ways to do this without getting in trouble. Praise publicly and criticize privately. And if there's a second criticism, it has to be in writing. And when you tell someone, okay, we just talked about this, I'm going to send you an email, when it's in writing, people know what that means. Like, they better act upon it or they're on the way out. So simply putting a gentle email to someone tends to change behavior pretty effectively. Okay, so here's the how to get things done. So it's really easy to send an email and a text, pretty fast, pretty efficient. The problem is they're often misinterpreted, and it kind of creates silos and somehow creates anger. Whereas if you have an in-person meeting, we tend to be nicer to each other. We tend to like each other more and trust each other more. So if there is something important, you got to go for that in-person meeting, even though it takes a lot more time. I like the idea that you never take a stand by email. If you're like angry and they send that email, that's not the time to send the email. Wait till the morning. Never take a stand by email. So Bruce Gartz is the surgeon that started recruiting all the top surgeons to Cedars, and he really helped elevate the program. In his book, he has a sentence saying, my relationship with you is more important than this issue. This is an amazing line. If you're sitting down with someone and they're mad at you about some certain issue, and you just say, you know what, my relationship with you is more important than this issue. We'll do it your way. Almost all the time, the people go, well, hold on for a second. I see your point on it, and you reach a compromise. It's very disarming. So how do we get things changed when I want a dedicated spine team? I only want certain people in my room, but nursing wants to put anyone in the room because it's easier to send them for lunch. They're all interchangeable. Get the nurse manager on your team. Do a study. And what we found out is if you have a consistent team, my surgeries took less long. We lost less blood. She was an author on this study. She presented it all over the country. And now she insists that we have a constant team in my OR. Get them on your team instead of fighting against them. Another example, there was one fluoroscopy tech who was so good, we studied him versus everyone else. The children got 3 times less radiation when he was the tech. Bang! He's in my room all the time now. This is at Children's, not now, Pat, don't worry. So our goal, we're just about at the end here, should be, how do we have people feel better about themselves when they interact with you? Sometimes you have to deliver a harsh message. Sometimes you have to ask someone to up their game. So one thing that science shows is simply smiling. If you just smile at someone, they feel better. That's one of the cool things that you can do as a leader. When you walk through your OR, you can just smile at everyone and make them feel better. It sounds simple, it's true. Like when you see Christian Jones, she smiles, you feel better. And the other thing is, the number one thing that's been shown for people to be happy at work or not is if they feel that their leaders have their back. Particularly publicly, if something goes wrong, the first thing is, I got you back, even though afterwards there may have to be some private criticism. People should feel you genuinely care about them. And the converse is true. If you have people on your team that you don't genuinely care about, you got to fire them. You got to get rid of them. You need people on your team that you genuinely care about. So, as I said, it's kind of awkward giving this talk because I'm not always good at this stuff. When I was a young surgeon, I definitely wasn't. And I was short with people, and I was too demanding, and I alienated some people. And I recognized and got better over time. I'd say one of the best professional days of my life is I walked in the OR and I see that people put Team Skaggs on their back, and they were happy to be on that team. And I give this talk because I hope that you have that feeling too, and you feel that you become a beloved team leader, and your patients benefit from it. And whoever sees my daughter, who's a PGY3 resident at Stanford, tell her she has to come to this meeting next year. Let's pressurize her. So, thank you. Yeah.
Fabulous as always, but I'm just slightly biased. I'll put you in a real life situation. So you're getting a stat call, one of those things where your phone blows up and your pager goes off, and then somebody right around you gets the same kind of a thing. And there's a patient of yours getting ready in the OR to be operated on a pretty complicated case. And there's the following standoff. This is a real life situation. There's a senior OR nurse Ratchet type, ex-military, great heart of gold, but pretty tough. And the following conversation took place, and there are multiple calls coming at the same time. The nurse had a different opinion from the neurosurgical, in this case, fellow. And at some point in time, that fellow who comes and was raised in a different cultural circle goes like, I am the neurosurgeon, you're the nurse, you'll do what I tell you to do. So this is a real life situation, and your pager just blew up, your phone just blew up, and you're the attending. So what are you going to do?
Wow. So do you have to make a real-time decision on something?
This is the case. The patient is asleep, and you're getting this call that this conversation just took place right now.
I think you have to have a private conversation with the neurosurgeon. I mean, I'm not sure I understand the question, to be honest.
No, I mean, the point is, again, we have multiple pressures. So this is a beautiful talk, but the question is, how do you handle acute care situations? You have a patient asleep, you're about to do a very major case, and there was a highly unacceptable transaction that took place, the old hierarchical, patriarchal kind of interaction.
Okay.
So you have a toxic OR situation as you're heading down into the OR. So how do you resolve that?
Yeah, so the question is, you do have to do something urgently. There's been some bad behavior. And I think the one thing we all have in common is we all want the patient to do well. And I think one kind of negotiating strategy is put us all on the same team, going in the same direction with the same mission. And I think one thing you could say to the surgeon and the nurse right there is, I know you are both professionals. I know you both care for that patient, and I know you can put aside a personal interaction for the benefit of the patient. And it's going to be hard for them to say no. They say no to that, someone needs to get written up and they're in trouble. So,
great, well handled. Yeah, all around great talk.
Thank you.